Hello to all. I am Vishnu. Welcome to my fourth episode in the series Amazing Facts About Medications. So, as you know, amazing facts or interesting facts about any five medications or any five class of medication, it can be random. That is what I will be sharing in this series. So, without any delay, let's go into the contents. So, as you know, the scope of this presentation is to enhance your practical knowledge in the highest level possible. So to get practical knowledge, there are two options. Either practically see, that is, you are going to the hospital, you are seeing such cases, and you are getting a picture of how things work and why. And practically visualize means you are studying a particular thing from the book or from an article, from a website, and you are correlating its effects with some other condition. So the examples have been written here. So this thing I have explained before also. I keep this slide common in every because many of you have the struggle, even if you are preparing for competitive exams, or even if you are doing your job, or even if you are, pursuing your hospital duties. Somewhere you have a struggle to remember things and correlate things. So this is why I kept this slide particularly with examples so that you get an idea as in what I'm trying to share with you. As I said always in the past video also, I had said this, please inculcate the habit of making your own notes. As long as you make your own notes, your memory power will definitely be excellent. Your handwriting will improve. Your writing speed will also improve. This is applicable to students who write descriptive answers in their college exams, whether it is the internal or the university exams. Your knowledge regarding the topic will increase because you are making your own notes. So whatever you are understanding from a particular reference, you are summarizing it in the form of your own scribblings or notes. So your knowledge regarding that will also increase. And definitely your presentation skills will also develop. So presentation can be in the form of your handwritten note. It can be in the form of PowerPoint presentation or a Word document. But if you are writing things on your own, then definitely you can present it well also. So let's come with the first topic today, P-glycoprotein pumps. So you may have heard of this term, P-glycoprotein. So P-glycoprotein are actually active transporters. P-glycoprotein pump are active transporters which are present in the epithelial cell of intestine. So what happens is when you take a drug, it gets absorbed into the epithelial cell of the intestine. The P-glycoprotein will throw that drug into the intestinal lumen. Now you know the function of lumen. That means it will get excreted from the body. So that is what normally happens. So in simple terms, the drug, when it goes into the body, after all the processes, it gets absorbed into the epithelial cell of the intestine. The function of P-glycoprotein will be to take that particular molecule and throw it into the intestinal lumen from where it is eliminated out of the body. Now, what happens is when there are tumor cells, you have heard like, there are so many cancers around the world. In tumor cells, what they have a special characteristic. They cause overexpression of P-glycoprotein. Now, you already know the function of P-glycoprotein. They pump the drug out of the body. So if there is overexpression of these pumps, when you take anti-cancer medications, they will also get pumped out of the body by P-glycoprotein since it is getting overexpressed. So that can cause anti-cancer resistance. So tumor cells, they cause overexpression of P-glycoprotein pump, which causes drug efflux. Efflux means from inside to outside. And influx means from outside to inside. So tumor cells will cause overexpression of P-glycoprotein, which will cause the efflux of the drug from inside to outside. That means from inside the body to outside the body. So that can increase the risk of resistance. So from this, you can derive a practical knowledge. I have already told you the function of P-glycoprotein. It helps in elimination of the molecules from the body. If any molecule induces P-glycoprotein, means activates P-glycoprotein, therapeutic failure can occur. Why? Because the drug will get eliminated from the body. So the efficacy that you require for a particular condition will not be achieved. If any molecule inhibits P-glycoprotein, then toxicity occurs. Why? Because if P-glycoprotein is blocked, then the drug will not be pumped out of the body. So it will get accumulated inside the body. So that can lead to toxicity or adverse effects. So if any molecule activates P-glycoprotein, for example, rifampin. Rifampin is an anti-tubercular medication that activates P-glycoprotein. So that results in therapeutic failure. And if any molecule inhibits P-glycoprotein, then drug toxicity can occur. So this is also a very important drug interaction. So that also we need to understand. To remember the name of the drugs that inhibit P-glycoprotein, try the code vaccine. So vaccine actually C is double C, but here I have used only a single C. You can just remember it that way. V stands for verapamil. Verapamil is actually a calcium channel blocker. And V also stands for valbenazine. Valbenazine is actually a VMAT type 2 inhibitor, vesicular monoamine transport type 2 inhibitor. This is actually used in the treatment of Huntington's disease. So if you refer my video on antipsychotic and their uses, you will get to know what Huntington's disease is, or it is also known as Huntington's chorea. So in tic disorders or Huntington's disease, we usually give valbenazine, tetrabenazine, deutetrabenazine, etc. A stands for amiodarone. Amiodarone, you know very well. It is a very powerful anti-arrhythmic agent. Amiodarone, as I have said in previous videos also, it causes both hypothyroidism and hyperthyroidism as its side effect, depending on the circumstances. So you can refer my episode series, in that you will find why amiodarone causes this problem. And amiodarone also causes severe toxicity to the lungs. It can cause pulmonary fibrosis. So that is why a patient is always advised that if you are taking amiodarone and you are experiencing non-productive cough or breathlessness, you should immediately stop the medicine and contact the physician or pharmacist. C stands for cyclosporin. Cyclosporin is actually an interleukin blocker. It is an interleukin type 2 blocker, so it reduces helper T cells. So cyclosporin is actually used in the treatment of autoimmune conditions. For example, organ transplantation. You know very well, in organ transplantation, what happens? Usually there is a risk of rejection because you are taking an organ from outside body. So when it is implanted in your body's immune system will try to reject that because it is an outsider. So usually we use immunosuppressants so that the over immunity is blocked. So cyclosporin is a immunosuppressant. The cyclosporin, since it is an immunosuppressant, it also has a high risk of causing infection, and also it causes dyslipidemia. Especially it increases the triglycerides level. And another very significant problem that is seen with cyclosporin is that it is nephrotoxic in nature. Please be very, very careful. If you are a clinical pharmacist, if you are working in organ transplant centers, or if you are even pursuing your hospital duties and you're getting exposure to organ transplant centers or anywhere where cyclosporin is being used, please remember the renal profile of the patient should be closely monitored because cyclosporin is nephrotoxic in nature and that can lead to other problems. So what are the problems? Cyclosporin is nephrotoxic in nature, so it can cause edema, fluid and sodium retention, and that can lead to hypertension as a side effect also. So for example, let's imagine a scenario where a patient is undergoing cyclosporin therapy and the patient is also suffering from hypertension as a comorbidity. We should be very careful. I stands for itraconazole. So itraconazole is actually an azole antifungal. So usually we use voriconazole, we use fluconazole, etc. But itraconazole is not that commonly used because it has its own myriad of side effects. Among this, there is a very interesting molecule that is known as ketoconazole. If you look at the mechanism of action of azole antifungals, they actually inhibit the cytochrome P450 enzyme in the fungus. So as a result, they cause the killing or they kill the fungus. But the problem with ketoconazole is that not only it inhibits the cytochrome P450 in the fungus, but in the human system also it has a tendency to inhibit the same. That leads to very severe hepatotoxicity in humans also. That is why you can very clearly observe ketoconazole is not administered systemically, but it is available in the form of creams. It is available in the form of shampoos. If you are having any fungal infection or something related to that on the scalp, we have 1%, 2% concentration ketoconazole shampoos. N stands for nifedipine. Nifedipine is actually a calcium channel blocker. The speciality of nifedipine is that first of all it is used to rapidly lower the blood pressure, and at the same time another speciality of nifedipine is that it is available in sublingual formulation also. So in sublingual formulation also we can take nifedipine. Then the last E stands for erythromycin. Erythromycin is a macrolide antibiotic. So it is usually a protein synthesis inhibitor. The speciality of erythromycin is that erythromycin estolate, there is a formulation, erythromycin estolate. This should not be given to pediatrics because it can cause severe pancreatitis, hepatotoxicity related problems, especially pancreatitis. Erythromycin, there is another speciality. Erythromycin, especially all macrolides, they are motilin receptor agonist. Now, what do you mean by motilin? M-O-T-I-L-I-N, motilin. See, from the word itself, you can understand motilin means motility. Motility means movement. So, movement of what? So, in the stomach, there are motilin receptors which helps in gastrointestinal transit or gastrointestinal movement. So, when the gastrointestinal movement becomes too rapid, diarrhea occurs. And when the gastrointestinal movement or the bowel movement occurs very slowly, then constipation occurs. So since macrolide antibiotics are motilin receptor agonist, they can cause diarrhea as a side effect. And erythromycin has a very huge tendency to cause the same. So that is one specialty. And erythromycin is also notorious for causing QT interval prolongation. So you should be very careful. In fact, avoid other medications that cause QT interval prolongation. Like you should not use erythromycin with other medications that cause prolongation of the QTC interval. This is very important. Actually, in another way, I had explained this in one of my videos. I had told about why anticholinergics cause fever as a side effect. So first of all, you need to understand that cholinergic nervous system activates your body secretions. Anticholinergics block your body secretions. So what happens in neuroleptic malignant syndrome? It's a life-threatening condition in which severe hyperthermia is seen. Your temperature may go beyond 40 degrees Celsius. That is around 104 degree Fahrenheit. So the main objective of hyperthermia or fever management is what? Whenever anybody is suffering from fever, we always try to make sure that sweating occurs in the patient. Why? Because when sweating occurs, the toxins are released from the body and it cools down the body. That means the temperature reduces. But anticholinergics, they usually block sweating because they block secretions of our body. So it will instead raise the temperature of the body. In that condition, if you are using anticholinergics in a patient who is suffering from neuroleptic malignant syndrome, the condition may get worsened. So in neuroleptic malignant syndrome, severe hyperthermia is seen. The main objective of fever management is to make the patient sweat so that the body temperature reduces. Anticholinergics, they block sweat glands, so they prevent sweating. If the sweating is blocked, the temperature can elevate. That can worsen the symptoms of NMS. Because if severe hyperthermia occurs, organ damage can also develop, seizures can also develop, that can lead to substantial mortality. To remember the name of acidic drugs, we can try the code weak acid. Actually, in reality, most of these medications are weak acid with respect to their chemistry. But this is just a mnemonic, weak acid. Weak W stands for warfarin. Warfarin, you know very well, it is an anticoagulant. And warfarin's mechanism is very simple. It blocks the clotting factors which are related to vitamin K. And that is why when you are having warfarin poisoning, the antidote that is used is vitamin K. The difference between warfarin and heparin is that warfarin can be taken orally, but heparin is not taken orally. It is given IV or subcutaneous. Warfarin is teratogenic in nature, so it should be avoided in pregnancy, but heparin is safe in pregnancy. A stands for anti-epileptics, for example, phenobarbital. Phenobarbital, you know very well, it is barbiturate derivatives. So they usually increase the level of GABA in the CNS. So that is good for GABA, you know very well, it is an inhibitory neurotransmitter. So it is good for providing sedation. And at the same time, it is also good for reducing the symptoms of epilepsy, because epilepsy happens when your brain gets overactivated. But again, the problem with phenobarbital is that since it is a CNS depressant, it can cause all problems related to CNS depression. And many cinema stars, models, many people who have been addicts to barbiturates have also passed away due to barbiturate poisoning or overdose. Especially in barbiturate poisoning, if you remember toxicology, in barbiturate poisoning, blisters form on the skin, which are known as barbiturate blisters. Phenytoin is actually anti-epileptic. So it actually prolongs the inactivation of sodium channels. So as a result of which the action potential get reduced. So as a result, it reduces the frequency of seizures. Now, phenytoin, it is actually a medication that requires therapeutic drug monitoring because it actually reduces the level of vitamin B12, which can lead to megaloblastic anemia. So the person will always feel tired, fatigued. Phenytoin can also cause osteomalacia through its own mechanism. It has some mechanisms by which it can cause osteomalacia. It can also reduce the level of vitamin D. So that is also bad for the bones. So, and phenytoin, especially if anybody is under phenytoin therapy, the most important counseling that we give to the patient is you should be very careful about your dental hygiene, because phenytoin has a tendency to cause abnormal growth of the gums in between your teeth. That is called gum hyperplasia or gingival hyperplasia or gum hypertrophy. So if you are using a toothbrush which is having hard bristles, so obviously hard bristles means it will have a detrimental effect on the gums, because the gums which will be formed in between your teeth, they will not be as hard as the gums which is above your teeth. They will be very soft and very spongy kind of. So if you are using hard bristle toothbrush, that can cause bursting of the sensitive gums and it can cause bleeding from that area. So that is why soft bristle or medium bristle toothbrushes are advised. Once again, if a patient is under phenytoin therapy, we usually advise them, we should be advising them to avoid toothbrushes which are having hard bristles. And even if you are using a soft bristle toothbrush, you should not brush your teeth very harshly, because due to phenytoin, gums, very soft gums will be formed in between your teeth, which is very sensitive. If you are using a hard bristle toothbrush or if you are brushing your teeth very harshly, then it can cause rupturing of those gums leading to bleeding. Then we have aspirin. Aspirin is also a weak acid. It is also known as acetyl salicylic acid. It has dose-dependent indications. So it has antiplatelet activity also. It has anti-inflammatory activity also. Aspirin should never be used in a patient who is suffering from bronchial asthma or COPD as much as possible. Why? Because if you look at the mechanism of action of aspirin, aspirin is a COX inhibitor, cyclooxygenase inhibitor. So if aspirin blocks the COX enzyme, then the LOX enzyme gets activated. I hope you remember the arachidonic acid pathway. Arachidonic acid pathway is classified into two. One is the COX pathway and the other is the LOX pathway. If the COX pathway is blocked, the LOX pathway gets activated. And LOX pathway releases some inflammatory mediators, for example, leukotrienes, and they are not good for asthmatic and COPD patients. That is why we use montelukast in asthmatic and COPD patients, because montelukast is a leukotriene receptor antagonist. So that is why clopidogrel is a very good option in such kind of patients, because its mechanism is entirely different. It has nothing to do with the arachidonic acid pathway. Then we have antifolates, methotrexate and sulfamethoxazole. Actually, sulfamethoxazole in combination with trimethoprim, it is known as cotrimoxazole. It is used in a lot of conditions, especially in a patient with HIV if the patient is suffering from pneumonia. If a patient is suffering from HIV and he or she gets pneumonia, it is not due to some normal organism. It is due to a special kind of organism known as Pneumocystis jirovecii. In that condition, usually the drug of choice is cotrimoxazole. And methotrexate, there are so many things that I would like to tell you. Methotrexate is contraindicated in pregnancy. In fact, it is used to induce abortion, because it is teratogenic in nature. So it is used in choriocarcinoma. It is used in a lot of different kind of cancers, breast cancer, etc., etc. I'll come into that later. C stands for chlorothiazide. Chlorothiazide actually is not used nowadays, but I just mentioned it. It is a thiazide diuretic. I stands for ibuprofen. Ibuprofen is a very commonly used NSAID. And D stands for dopamine precursor, that is levodopa. So some specialities of levodopa in my episode 1 of this series, I have explained. You can refer that. Levodopa is used in the treatment of Parkinson's disease. Now let's talk about plasma protein binding. If plasma protein binding increases, the drug will be confined to the plasma, obviously. So lesser drug will be available for tissues. So as a result of which volume of distribution will reduce. So always remember, plasma protein binding is inversely proportional to volume of distribution. Why? Because if plasma protein binding increases, the drug will be confined to the plasma. Less amount of drug will be available for the tissues. So the volume of distribution will reduce. Acidic drugs usually bind to albumin, and basic drugs bind to alpha-1 acid glycoprotein. So acidic drugs, already I mentioned a mnemonic. So acidic drugs, they bind to albumin, and basic drugs bind to alpha-1 acid glycoprotein. If you are suffering from nephrotic syndrome or liver cirrhosis, in that condition, plasma albumin reduces. If plasma albumin reduces, so the acidic drugs will not be able to bind to that. So they will be available in the plasma. Since the albumin is not there, acidic drug will not be able to bind to the albumin, because albumin is not there. So they will be present inside the plasma. That can cause severe toxicity. So that is why in nephrotic syndrome or liver cirrhosis, if we are using medications which are having high plasma protein binding, and if that medication is an acidic medication, we should be very careful and monitor the patient for any kind of side effects. If you are suffering from an autoimmune condition like rheumatoid arthritis or any kind of inflammatory condition known as inflammatory bowel disease, the alpha 1 glycoprotein will actually increase. So this is an interesting thing. So in patients with rheumatoid arthritis or inflammatory bowel disease, alpha 1 acid glycoprotein increases. So if that increases, then there will be lesser free basic drugs because as I already told you that basic drugs bind to alpha 1 acid glycoprotein. So if the number of alpha 1 acid glycoprotein increases, then more basic drugs will bind to it. So lesser drugs will be available in the plasma. And if lesser drugs are available in the plasma, we will not get the proper efficacy that we require. So therapeutic failure may occur. If a drug has a high plasma protein binding and a narrow therapeutic index, for example, phenytoin, focus on unbound plasma drug concentration level rather than total plasma drug concentration level. Unbound means the quantity of the medication which is not bound to the protein. So that we have to check. If a drug is having high plasma protein binding, it will also have high concentration in the plasma. In that condition, it may displace other drugs with the same feature. So that can lead to displacement drug interactions. And this can also displace bilirubin from albumin. So that can cause kernicterus in newborn. So that is why you should be very careful if you are using any medication that is having high plasma protein binding in neonates. Because you know very well that when a child is born, the liver is not fully developed. And that is why the bilirubin level in children will be very high in comparison to us. So already the bilirubin is high. And if you are using a medication that again increases the bilirubin, this bilirubin will cross the blood-brain barrier, get into the CNS and cause its own manifestations, and that is known as kernicterus. Most of the CNS drugs, they are highly bound to albumin. That means most of the CNS drugs are acidic in nature, except tricyclic antidepressants and opioids. So tricyclic antidepressants and opioids, they usually are less bound to the albumin. And most of the antiarrhythmics are alpha 1 acid glycoprotein power. Most of the antiarrhythmics, that means they are basic in nature. To remember the name of drugs which are metabolized by CYP3A4 or which are substrates of CYP3A4, you can try the code MyCharlie. My-M stands for mifepristone. Mifepristone is a sex hormone antagonist. That is, it's an estrogen receptor. It is an estrogen antagonist. Mifepristone. C stands for calcium channel blockers. Cyclosporin. H stands for HMG-CoA reductase inhibitors. For example, statins. Atorvastatin, rosuvastatin, pitavastatin, etc. A stands for antiarrhythmics. For example, lidocaine, quinidine, and mexiletine. Mexiletine is not used nowadays. It is actually banned from the market. R stands for rapamycin. L stands for long-acting benzodiazepines. For example, diazepam. I stands for inhibitors of protease. That means protease inhibitors. So these are usually used in the treatment of HIV, atazanavir, ritonavir, amprinavir, fosamprinavir, etc. And E stands for erythromycin, estrogen, and progesterone. So that's it for this presentation. So I have explained 5 interesting things to you today. I hope I have been of service to you. It takes a lot of time and dedication to make notes and then get them converted into PowerPoints and share this knowledge with you. And yes, my videos are usually a bit in detail because I don't simply read whatever is written there. Whatever comes into my mind related to that, I also speak. So that can be an additional information for you. so that you can note it down for your practical knowledge enhancement. If you appreciate my efforts, then please do subscribe and share this to maximum people, because knowledge is power and knowledge shared is knowledge doubled. If you require the PowerPoint version of this presentation, please contact me at LinkedIn. I will be very happy to share it with you. So see you in the next video. Until then, it's goodbye.